औज़ुबिल्लाहि मिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम रब्बिश शरह ली सदरी व यस्सिर ली अमरी वहलुल उक़्दतम मिन लिसानी यफ़क़हू क़ौली. Assalamu alaikum. My name is Dr. Ahmed Raza Khan, and continuing with the autopsy series, today we will be dealing with the objectives of medico-legal autopsy. The very first objective of the medico-legal autopsy is to make a positive identification of the body and to assess the size, physique, and nourishment status. Now, whatever we do regarding the medical legal autopsy, whether it is the biodata of the individual that we collect, that is his name, age, gender, the people who identified the body, the constables who brought in the body, the time when the police documents were provided, the time of death stated by the police, the apparent cause of death stated by the police. After that comes the external examination, and that external examination is one of the main parts of that is to make positive identification of that individual. Now, in case of a known dead body that has been brought in by the police and the relatives are accompanying that body, the third party identification is the most authentic identification in that scenario. But besides that, if an unknown body has been provided by the police, whether it has been a drug addict, it has been a beggar, or anybody unknown in that status, or it's a very well-nourished, healthy individual and has died under suspicious circumstances, and nobody knows the relatives of that individual, nobody knows any whereabouts of that individual. Maybe he was an individual from some other city who came in this city for some business or pleasure. In that case, you have to make sure that you establish some identification of that individual, like some identification marks on that individual, on the body of that individual, the subjective and the objective identification. That will be dealt in detail with the presentation of personal identity, but just to give a highlights about that here, that subjective and objective identification of that individual, anything related to the subject, any tattoos, any specific marks, any specific identity marks, any specific bony prominences, any specific landmark on the body, like an extra digit of a finger or something like that. Then coming on to the height of that body, the stature of that body, the appearance, the nourishment, the physique, and all that is included in this general description. And in cases of starvation as a cause of death, you will state obviously that the body is emaciated, not well nourished, or very undernourished, and things like that. So this is the first point in the objective of a medico-legal autopsy, to make positive identification of a body and to assess the size, physique, and nourishment. Secondly, now we have to determine the cause of death. What was the cause of death? Like, for example, if it's a healthy individual in his 30s or 20s and the individual is lying on your autopsy table, on your mortuary table, why is this individual dead? What caused the death? What was the damage done by the weapon that inflicted that damage? Whether it was a firearm injury, whether it was a blunt means injury, whether it was a sharp edge injury, what damage did it cause? Like, for example, we say that cause of death in this case is damage to the skull bones and brain under injury number 1 caused by the firearm weapon. So the second main objective of the medical legal autopsy is to determine the cause of death. Thirdly, we have to determine the mode of death. If the damage inflicted was on the brain, then the mode of death is coma. If the damage inflicted is like strangulation, like manual strangulation or ligature strangulation, then the mode of death is asphyxia. And then even in case of drowning, the mode of death is asphyxia. And then thirdly, if it was any major blood vessel was hit, heart was damaged, and there was severe hemorrhage and bleeding and leading to syncope and shock and eventually death, then in that case the mode of death is syncope. Fourthly, to determine the manner of death. Basically, the determination of the manner of death is part of the investigating authority, and that is the police. But at times, police may request the doctor conducting the autopsy to give their expert opinion regarding any findings suggestive of the manner of death. Like if a body has been found hanging, the police might inquire to you whether it is suicidal or homicidal in nature. Then, if there is a firearm weapon found held in the hand of an individual and it's a very close contact, firm contact, temple wound, then the police might ask the autopsy conducting doctor that whether this infliction was suicidal or homicidal in nature. So, determination of manner of death is yet another important objective of medico-legal autopsy. Then to determine the time since death, a very important thing. Time is the most important factor and a very important corroborative factor that an autopsy doctor concludes via the autopsy findings and the history given in the FIR by the police. So determination of time since death is yet another very mandatory, cardinal, important objective of medico-legal autopsy. Then in case of a fetus, the doctor who is conducting the autopsy has to determine whether the fetus was born alive or whether it was a macerated fetus that was already dead within the uterus and it was delivered somehow, or whether the fetus delivered it was alive when it was given birth to and it was later killed on. Then at times you have to assess the viability age, that what is the actual age of that fetus. Was it of a non-viable age, was it of a viable age, or was it a full-term fetus? All these factors are to be determined on the autopsy of a fetus. Coming on to the next objective of medico-legal autopsy is to demonstrate the external and internal abnormalities, malformations and diseases. Just remember, as I already told you, that autopsy is conducted in even some natural deaths where police wants to rule out any suspicious circumstances. In that case, if there is an apparent disease, then you have to report it. Like if there is a very hypertrophic liver or a very shrunken liver, cirrhotic liver, all these things are to be stated in your examination, both external and internal. Then next, to detect, describe and measure any external and internal injuries. This is the most important part of it. You have to narrate the injuries, as many as there are. Sometimes the body is ridden with bullets, like there are multiple firearm injuries. Sometimes the body is full of bruises. Sometimes the body is entirely burnt. So everything is to be explained in detailed examination. The injuries are to be narrated, both externally and internal damage that has been inflicted due to those external injuries. Next is to obtain samples for analysis of microbiology and histological examination. In cases of that, you have to prove that the death was due to natural causes, or the other way around, that you have to state that the death was not due to natural causes. In that case, the viscera sent for histopathological examination are most important. And the microbiological examination is then again important for the detection of any septicemia, sepsis, infection in the body. So these samples are to be sent for these examinations. Next, to obtain samples for toxicological analysis. In case of poisoning, in case there is a suspicion of poison being given to the individual, the viscera are collected and sent for toxicological analysis. Then, to retain relevant organs and tissues as evidence, a very important objective. Sometimes the things are to be cross-checked. Sometimes a second opinion is required. Sometimes the case is challenged, and then again the examination of the same slides is to be conducted over by some other expert. So the relevant organs and tissues are to be preserved and retained as evidence. Then to obtain photographs and video for evidential and teaching uses, very important. Although in Pakistan so far the pictorial, the video and these photographic evidence is not admissible as a documentary evidence, but for teaching purposes it's a very excellent exercise. Then to provide full written report of autopsy finding, all the details are to be provided in that. The biodata, the identification, the general description, the injuries, the external injuries, the internal damage caused by those external injuries, and then the viscera, those were normal and healthy, are to be stated as healthy. So a complete provision of the report of autopsy findings is yet another objective of medico-legal autopsy. Then, very important, after that you have given the entire narration, you have to offer an expert interpretation of the findings. Like in case of a firearm injury, the opinion might be opined as that the injuries stated above are ante-mortem in nature and caused by firearm weapon, and the cause of death in this case is damage to the aorta and the left lung, leading to hemorrhage, shock and death. And all these injuries are sufficient to cause death in ordinary course of nature. So this kind of a expert opinion is to be framed and given to the police, which is to be then provided in the court for evidence purposes. Then to confirm or formulate cause of death if possible on exhumation. Yet another medico-legal objective, that if sometimes the exhumation is done under couple of scenarios. Number one is that the body was to begin with just disposed of. Somebody killed someone and disposed of that body, like for example in a shallow grave, and somehow it was recovered, and that body is then provided for postmortem examination for autopsy, medico-legal autopsy for the cause of death. Then sometimes the body is already buried by the relatives, and later on they come to know some circumstantial evidence that, like for example, if a female died and then the neighbors of that female tell the father of that individual that your daughter was killed by her in-laws. In that case, the individual then approaches the magistrate and gets an order for exhumation for the determination of cause of death. And thirdly, even if to begin with the initial medico-legal examination, a medico-legal autopsy was conducted, a report was issued, yet the aggrieved party or the other party, they are not satisfied with the report, then they can challenge that case in the district standing medical board or provincial standing medical board for re-examination of that dead body. Next, to restore the body to the best possible cosmetic condition before release to the relatives. This is one of the main reasons that the spinal and the vertebral column is not opened up if it is not damaged due to any injury. The only reason for not opening up the spinal and the vertebral column is that you have to preserve the cosmetic look of the body. Otherwise, all the cavities are open up, skull is open up, cervical cavity is opened up, the chest cavity is opened up, the abdominopelvic cavity is opened up, but the vertebral column is not to be explored in detail until and unless it is required. If like for example a firearm injury was inflicted and a bullet, either it was a ricochet from a bony landmark or it directly penetrated the vertebral column, or if there was a sharp edge, heavy sharp edge weapon injury that cut through and through the cervical vertebra along with all the neck structures, then the vertebral column is to be examined in detail and a comment is made regarding the damage to the spinal cord and the vertebral column. Finally, the last objective of the medico-legal autopsy, a facial reconstructive procedure in case of a suicide bomber. The suicide bomber usually adopts a posture that destroys his entire body along with the face. But sometimes, partial face is recovered, and that face needs to be reconstructed. And for that, we have forensic artists in our department in King Edward Medical University and in Allama Iqbal Medical College. Those are gem of artists and very well gifted artists, and they, along with, in collaboration with the forensic doctors, they reconstruct the face in case of that suicide bomber. Now, these are the total objectives of medico-legal autopsy, and these 3 slides are important, and you just have to reproduce them one by one to get the maximum marks out of the short essay question, and the narration in between was once again for that the viva and the OSPI questions that are asked. So stay tuned in. The next lecture is going to be about the techniques of autopsy, followed by the incisions and the cavity exploration during the autopsy. Take care. Allah Hafiz.